Good evening, everyone. I hope you're all well. My name is Dumim Simang, and I will be your host for this evening's Clinical Associate Career Information Session. A warm welcome to all our students and our guests. We have clinical associates from Wits University, the University of Pretoria, as well as Walter Sisulu University in this call. So a warm welcome to all of you. Really so happy to have you join our webinar today. Today is the second webinar of the monthly series. These online sessions will be held monthly on the last Monday of each month. So the aim of these webinars is to have qualified clinical associates come in and share their journey as they navigate different workplaces and have new endeavors in different places. So it's an opportunity for clinical associates to share their experience, to share their challenges, to share the good, and for you as clinical associate students to then ask these clinical associates these burning questions. Sometimes the students you feel that the lecturers aren't always giving you the real answers, or that the lecturers don't really have a full perspective. And this is an opportunity for you to hear what it's really out there as a clinical associate in the working world, and to ask the questions that you need to ask so that you can make informed decisions about your career, about your trajectory as a clinical associate. It's really important that you students gain insight into the postgraduate world and hear what the new professional developments are, what the new activities are as clinical associates, what the new paths are as clinical associates, as well as what challenges we face and what achievements we also face. As ClinAs, or in general, the medical field or the medical world is always evolving. So it's very important that we get some insight into it specific to our chosen profession. As I mentioned when I started off the discussion, my name is Dumim Simang, and I will be your host for today's session. I am a clinical associate myself and am currently an educator with Wits University. I graduated from the University of Pretoria in 2012 as a clinical associate and started working as a clinical associate in 2013. Personally, in my own capacity, my career path has also taken many different directions, working in different spheres of the medical space, in different spheres of the health system, private, public, NGO space. In 2016, I completed my diploma in project management, and currently I'm busy with my MBA in healthcare management. The reason for those two postgraduate degrees personally was because of my deep passion for clinical medicine, health science education, and ultimately my love for the management systems within the healthcare sector. So just to give you a little bit of insight about myself and where I come from and why I'm so passionate about this degree, as I said, I'm currently an educator or a lecturer with the clinical associate program. So as we hear today, my aim, or the aim of these kind of sessions, are that we strengthen the community of practice that we have. This is an opportunity to connect and network with clinical associates, to learn about different career pathings that your career can take. So it's really important that we make a concerted effort to engage in these sessions as students and even as the greater clinical associate community. So on that note, that was my long introduction for the day. So on that note, we're going to have two guest speakers today, and they are very excited to tell you about their journeys as a clinical associate and where they're going to now. So my first speaker of the day will be Shereshnee Govender, who graduated from the University of Witwatersrand in 2014 and started working at Kopanang Hospital after she graduated. She has a big passion for emergency medicine and surgery. I'm not going to go too much into the speakers' bios because they have so much to tell you themselves.
Hi guys, just a little bit about myself. My name is Shereshnee Govender. I graduated in 2014 from WITS, and I have been working as a clinical associate ever since. Just a little bit about myself. I'm a new mom. I'm sure that can explain my tired eyes. I'm also a very, very passionate clinician. That's why I've been in the clinical space as long as I have. I have ventured through many different fields of medicine. I have rotated through a lot of specialities, but like Tumi said, my heart has remained in emergency medicine and surgery. I now currently work with a nephrologist at Ahmed Katrada, and I'm looking to further my postgraduate studies in emergency medicine. So just a little bit about my work history. So I started off at a district level hospital called Kopanang. I was there from about 2015 to 2019. I then ventured into private medicine, joining an emergency medicine company called ER Consulting. I was with them for about 2 years. Then I joined the gynae. So gynae was actually my first love, but then I quickly came to realize that a midwife trumps a clinical associate. I will go into a little bit more detail later on when I talk about my challenges on why I say this. So yeah, I was with them for a very short period. I couldn't overcome the challenges in that department. And then I moved over to the nephrologist that I'm currently working with, and I've been with him for almost 2 years now. It is internal medicine, not where I would have loved to be, but I am enjoying it, and I have done quite well where I am right now, and I've learned quite a bit. So these are just a list of the many courses that I did complete. Most of them are emergency medicine based. So like our BLS, ACLS, I did ACLS for experienced providers, ATLS and PALS and so on. So I did a lot of those short courses while waiting. Like I said, new mom, really hadn't had time to think about postgraduate studies till now. So definitely looking into that starting next year, hopefully. And we'll see if I can get into the emergency space then. So a typical day in my life. A day in my life would be I start with inpatient ward rounds. I will then see patients with renal related conditions. Once I'm done seeing them, I will then maybe do a dialysis ward round. So the nephrologist I work with has 3 dialysis units, and we have to see those patients at least once a week. He has about 90 chronic patients. So between the two of us, we would then split up and then do dialysis ward rounds as well. And then once I'm done with the dialysis ward round, I will then do any ward work that's needed to be done, which include doing dialysis ports, central lines, A lines, acidic taps, LPs, and yeah, that's about it. And then I will also have to do some admin. So there's transplant admin that I do, and admin for like medical aid motivation letters. And yeah, then once I'm done with that, at some point in the day, I will catch up with the nephrologist that I work with, and we'll go through the inpatients. So how we work is that I will see patients independently. And then if I have any challenges that need urgent attention, I will then call him. If not, then later on we'll just discuss about them, and then we do a grand ward round. Every alternate day, we will go through all the patients together. At the dialysis units, it's a little bit different. These are our chronic patients, so we know them well. We just go to see if they're getting adequate dialysis and if there's any challenges that we can address there. Once we're done, again, we'll catch up with him, let him know what's going on. And yeah, then I do one weekend every month. So on this weekend, I cover our inpatients. So I will just go in for a weekend ward round and then discuss the patients with them telephonically. And yeah, that's about what my day looks like. So challenges and my coping methods. So being a clinical associate, one thing that I've really battled with is not having the final say when it comes to a patient. It's very difficult because as you grow with experience, you also learn to treat patients in your own way, and you have an opinion on how you want to treat a certain condition. The problem with being a clinical associate is that your opinion sometimes is not always heard. And even if they do hear it, the final say or the final treatment plan is then done by the doctor. So my coping method with that is just making my presence heard, addressing and advocating for my patient on why I think we should go this route and why not. Always underestimated. We are always underestimated by everyone, by the nurses, by even allied staff like your physios and dietitians. We will always be underestimated. And my coping method there is showing them what we can do, showing your experience, and overall just showing them your value in the team, which we do hold quite great value in there as well. And the other thing is just not being recognized. So no one knows what a clinical associate is. I mean, until today, I meet specialists that don't know what a clinical associate is. So we have to educate them. So how I explain myself to the patients is that, because the minute they hear clinical associate, they're wondering like, okay, then what do you do? You know, you're the doctor's assistant, you're a nurse, are you a doctor? Those are the questions you get asked. So I educate them and I let them know that being a clinical associate, my job is to get the ball rolling. So I can help you right now while the doctor is preoccupied with something else, and I can get things going with your treatment in the meantime. So I'm the person that's on the floor. I'm the person that's running if there's an emergency. I'm the person that they will see most of the time. And yeah, and then they sort of then get to know me as that. My advice to all of you is be a clinical associate. So we get swept into this, oh, we are like doctors. And I feel like this is the problem on why we're not being recognized. I feel that we need to show people what clinical associates are and what does it mean to be a clinical associate. We are a fairly new profession and we are still finding our feet. The best way we can do this is just not be okay with being called a doctor, because people will call you that. Just correct them. Tell them that you are a clinical associate and explain to them what do we do. Explain to them our limitations as well so that they understand. And also the other thing is never take no for an answer. Our scope is quite, the limitations in our scope is not, I don't know how to word this. There's room to grow and there's room to achieve more. We are not very limited. The limit in our scope is supervision. That's the main thing. But we are not limited to how much we can educate ourselves with. We are not limited to what skills we can learn. We are not limited to what procedures we can do. So never take no for an answer. If someone tells you no, you cannot do a certain procedure because you are a clinical associate, your answer should be then educate me, teach me how to. And if your supervisor is okay with that, there's so much we can learn. For an example, sonar guided lines. So this is what I do at the hospital that I work at. And this is a skill that many doctors don't even have. And I've gotten so good at it that some of the nurses, they even compare me to the casualty doctors that taught me these skills, telling them how great I am and how I'm better than some of them. So never take no for an answer. If you are interested in something, go out there, learn it, and get to where you want to be. So yeah, that's me, Shereshnee.
Thank you so much, Shereshnee. Really, really, really appreciate your insights into being a clinical associate and what it's all about. So the first question in the chat says, how did you go about exposing yourself to from being an unemployed postgraduate? Did you have any challenges of not being employed due to lack of experience? And if so, how did you overcome that?
Okay, so thank you for the question, guys. So I was fortunate enough to get a post because of I had a bursary with the Department of Health. So then I was placed just after graduating. So I graduated in December, and I got my post and I started 1st of Jan. So I didn't have challenges getting a government post. And then what I did do, because I knew we did not have, because our degree is so short and they needed to put in a lot for us, we didn't have enough time, I felt, during rotations. They weren't long enough. So then I decided in the hospital I was at that we as clinical associates have to rotate through each department for 6 months. So what I did then was I stayed until I rotated through each department so that I became more well-rounded. And then once I did that, which then I was there for 4 years doing that. Once I did that, then I ventured on into private, and gaining that experience helped me be more employable. And yeah, that's how I basically exposed myself.
So thank you so much again, Shereshnee, for your insight. I think it was really important, the information that you shared with the students. Also important that you did go through challenges that you face, and really, really interesting. I actually have been hearing a lot about you recently, about the work that you're doing with guided ultrasounds. So really interesting, that space that you're occupying. Okay, I am going to move on to our next speaker, Mr. Navesh Moodley, who is a personal friend of mine, and also an ex-student of mine. And he graduated from the University of Pretoria in 2017, and then started working in Port Jefferson Regional Hospital soon afterwards. He's currently working at UP as one of the lecturers, and his passion is mainly surrounding management and his students. But let me not say too much about him, because he has got a lot to say and a lot to share. So yeah, Navesh, you're welcome.
Hello, everybody. I'm Navesh Moodley. I am a clinical associate, and yes, I'm Mrs. Tumi Msamang's previous student, when her surname, which will not be mentioned, was something else. I graduated from the University of Pretoria in 2017. Didn't really know what a clinical associate was. I remember the day my mom comes home and she's like, Navesh, I got you a bursary for something, but go for it. I come from a previously disadvantaged background. Parents didn't finish school, but she's like, go for it. I mean, you're getting a bursary to go and study something. Go and do it. So at that time, I had acceptance into MBCHB and accounting, and then I had bursary for accounting, and I didn't know which one to do. And I landed up there. Got to UP, and firstly, I was amazed by what a medical campus was. And I got into it and didn't have any insight to what a clinical associate was. I mean, they explained things and they went in and they told us, this is what a clinical associate is. Back then, it was not as clear as it is getting now. And I'm not saying that in a sense where it isn't completely clear, not clear at all, but clarity and the definition of what a clinical associate is in the working space is much more affirmed now than it was many years ago. So more people know about it. Patients do have some insight. You do have a lot of people that don't know, but people are starting to come to know. And I think that's good. So a little bit about me. As Shereshnee had mentioned, those who had gotten funded by the government ended up in working for their district hospital. So I was fortunate enough to be placed in the hospital I was born at, worked alongside the doctor who actually delivered me back in 95. And it was fun. They didn't know what a clinical associate was also entirely. The post I had filled was someone who had passed on tragically, and they had nothing but a few months with the person. So they didn't really grasp the concept of a clinical associate and what the capabilities were. So I had gotten in, and they gave me an option between emergency med and family med. And I decided to stick with family medicine. again, not having, just dipping my toes into the water, but not really knowing again what my purpose was. And I'll get to that towards the end. So, worked for Jefferson Regional Hospital for 3 years. And I had resigned because it was time to come back home. And I consider Gauteng home. And I miss every moment of it. I think what you do in whatever you study, whatever you go into, be the best you can be. And that was my goal before I'd left Potchefstroom, to make a mark of what a clinical associate is. And I did just that. So while I was in a clinical associate in Potchefstroom Regional Hospital, I've seen many patients. And my favorite were the incarcerated patients, psych patients that would come through, family medicine. And I found my passion in relating to people and humanity. And for me, practicing was humanity first. And when I connected with my patient, I was able to treat them better and meet them where they were at. You'd realize, and I think this comes with practice, that sometimes management doesn't necessarily mean I need to give you pills and I need to give you medication, but sometimes it's just a chat that a patient needs with someone they don't know. And it was fun working there. And when I had resigned, I had joined with Donald Gordon thereafter. So in my years of Potchefstroom Hospital, I shortly went straight into management. I was second in charge for family medicine. I spoke to my boss about my passion in management, and I had started my MBA back then. And then I took a break, and then continued, took a break, and finally at this point, I decided to start my thesis. So during those years, I was delegated a lot of management responsibilities, which involved me seeing a lot of PRO'd cases from the hospital, where I had to take over management of a lot of patients in the hospital that disputed with other practitioners. I was also involved in a lot of training in within family medicine and in-service training, updating protocols and so on. And at some point, the people I worked with could not differentiate by the knowledge I had accrued, and somewhat even said, well, it's very surprising that you can have a clinical associate that knows more than some of us. And I said to them, it's not about the rank of qualification you have, but your ability to want to know more. And that was my beginning to understand at that time what your limits can be and how you can push through limitations of what is said. On Wednesdays, we wear pink. So I had joined Wits Donald Gordon Medical Center in the vascular endovascular field. I also worked there for a very short time. As Shereshnee had told you previously, there are challenges in certain places where you work. So I didn't have any issues when I worked in government. My issues came in when I worked in private, because I had never worked in private, and it was the first time I had worked in private when I worked at Donald Gordon. And it was very difficult to adjust. And of course, with the difficulty in adjusting, I had amazing colleagues that I had worked with, previously known as well. Some of them I had known prior, good friends. Some of them were people I had studied with. But the working environment was good. Um, Sometimes we cannot foresee what circumstances would come. And at that time, I had taken uh, a heavy mental knock, if I can call it that. And the workload was not conducive to my well-being. And I had resigned from Wits Donald Gordon. Shortly after that, vascular endovascular surgery was actually a really, really good experience for me. It's something I really like as well. I realized that I like that working with patients, and had a chat prior to this with Shereshnee. We'd see some of their cases as well to do their grafting, their fistulas, and so on for dialysis. And that's what we did in vascular endovascular unit, apart from every other peripheral vascular disease you can get under the sun. So that was super fun. It was lovely working in the only private institute or teaching institute in the country, and it was an honor to have worked there. I then, straight after that, joined the University of Pretoria as as a clinical lecturer. Um, and I've been there from 2021, late 2021 till now, with my latest achievement being the final year coordinator for the BCMP program at the University of Pretoria. I think at this point I've decided I'm going to stay in academia. It's been, apart from management, which I get to do that now, I have found a very, very interesting passion for education, which I didn't think in my wildest dreams I would actually get to. And I had told my boss nothing but a few days ago that it's surprising how a group of students can come into your life and validate you in your workspace, or a group of people per se. And that's what had happened last year. And I discovered that this is what I want to do. And I will get to do whatever else I wanted to do, the administration part, management, seeing to students and teaching and educating. And I, I can't begin to, I think if I had to tell you about my likeliness for anything else other than education at this point, I don't think I can tell you that far. But all I can say for those invites, you will see me around. I do come during the examination times as an external moderator, and sometimes you'll see me as an examiner. But I think being a clinical associate is such an honor, and not in a sense where you would think of the negative implications of being one. You're still at the forefront of it, meaning you're still very fresh, you're still the new ones. And when the degree has passed on for many, many years and it goes on, you would have been recognized as one of those trailblazers, the pioneers of the program who had initially started it. And remember, we're not very long into the clinical associate program. It's nothing over 10, this is the 11th year of the profession. And you would think that in 11 years, we wouldn't have gotten this far. And I can tell you from our end, we are seeing a really, really high demand of clinical associates, especially in the private sector, to which we had decided last year that we need to make some curriculum adjustments to accommodate teaching in the private sector and how we're going to actually do that. And the dean, deputy dean of education at the University of Pretoria was like, well, why don't we move it to a 4-year degree? And there are plans underway for that at the University of Pretoria, the way it will move at some point in the near future to a 4-year degree program. It's already been spoken about to the graduates of last year by Vanessa Steenkamp, and she was quite excited about that. So I think it's something everybody should be looking forward to regarding that, and more post-grad opportunities. We are also working closely to develop more programs for the clinical associates, especially post-grads, and we're looking into that this year, especially on our side with the different specialities. I think for now, the only one that's available is emergency medicine at the University of Witwatersrand, but there are clinical associates who are studying different things. Like Mrs. Samang had said, she's doing her MBA now. I'm also doing my MBA. You have other clinical associates who have done emergency medicine, those who are currently doing family medicine as a postgrad. And there's a lot that goes in. There's people who are doing research. There's so many different things that one is getting involved in, and I tell you, you'd be surprised. I don't know what else I could say. I think at the end of it all, and I think this is my take home point for you guys. Oh, I want to tell you about this picture while it's up before I tell you my last bit. So I worked with the ComServe, right? And she, brilliant girl. And one day she wasn't at work, and it was very early in my career in 2018. I think it was nothing but 3 months. And by the end of that day, that was what my desk looked like. I had to look up everything. I told the patients, like, wait, I need to see and I need to make sure I'm treating you right. And I realized that it's not wrong to pick up a book and read. And sometimes in front of a patient, you may think it's not professional, but I really do think a responsible practitioner, in the light of not knowing something, has ability to say, I need to read this up, or I need to check this quickly against the EDL so I know I'm giving you the right thing. And I think that's what responsible prescribing and practicing is. So that was the highlight of that day. And I'll never forget that day. I had seen, like, I think almost 50 patients, and I was exhausted by the end of that day. But those were the little moments. I put very specific pictures in this PowerPoint, and I tried not to put words in it because I want you to get drawn to what the pictures are saying. And this one was one of my highlights, where I realized I actually really like what I do. And very early in my career, knowing that this is where I want to be. So to my last point, my pearls of wisdom. I think we all say, have choose wisely when you're in school. You need to know what you want. And the truth is, sometimes we just don't know where we are at as people, and we are always changing, and we always find different passions and different likings for different things. And I like that one picture where it has mortuary on the other side and casualty and OPD on the other. I think this was taken in Shongweni Hospital when I had gone last year. And for me, it was death and life. Which one would you choose? And similarly, what you choose for yourself is entirely, firstly, up to you. Uh, I think if if there's anything I want you to know or want you to do, is firstly to discover who you are as a person, before anything else. While you're going through, and it can take a long time, it can take a short time. It's very dependent on your personality and how you process things. But discover who you are first, because in discovering who you are first, you'll understand where you are at now in your life and what you want now. You are able to establish long-term goals and short-term goals. Um, Even if being a clinical associate is not your be all end all, and that might even change. But right now, what do I want to achieve as a person first, and then as a person studying in the healthcare sector, what do I want to achieve? And then thereafter, what do I achieve after that? So understanding yourself first before you understand your purpose and what you actually really want out of this program. I had seen someone had written something about the salary scales. I promise you, I was also one asking about money because I'm Indian and everything is about money. I'm just kidding. But at some point, even that fades away. You get so drawn into what you want to do with people that sometimes it doesn't matter anymore. And as a clinical associate, I mean, government did not pay the best salary ever, but we lived. And at some point, we became okay with it. Charles Darwin always said survival of the fittest. And in private, it's very dependent on how you work. So the types of jobs you take on and what you can do. Some people work 2 to 3 jobs, and some people work two, and some people work one. And it's very dependent on what you are required to do, and that's how you will earn. So for now, I don't want you to think about that because the program is as intense as it can be, and some may say even more intense than MBCHB. So I think focus first on getting through the degree before you focus on anything else. Yeah, that's my little bits and pieces about being a clinical associate. Any questions?
Thank you so much, Navesh. It was so good to hear your insight. Obviously, I know all the stuff because we have a personal relationship, but really just nice to hear from your side of the story, like everything and how you feel about the profession. And just to echo like two things that I picked up by two speakers today. So just to really echo what the two speakers were speaking about today, which I thought was really, really important, was that, you know, this profession is so much more than just, an easy entry level or whatever you may think it is. There are so many avenues, and what Shereshnee and Navesh just highlighted so very well is how you can kind of find your footing as a clinical associate, and you can explore, and it allows you the flexibility to kind of explore what you want to do and what your passion is and where you fit in the grand scheme of this medical field or in the grand scheme of this clinical world. And I personally love that. Having come from different types of environments in the clinical setting, and now having found kind of what my niche is and what my passion is, other professions wouldn't really have allowed you to do that. And as a clinical associate, I've been allowed the last 10 years, I've been a clinic for 10 years plus, to really kind of find my footing and decide what it is I love, what it is I'm passionate about. And as Shereshnee pointed out, you may think your passion lies in something like hers lay in obstetric and gynecology, but then she figured out that actually that's not for me, and now her passion lies in emergency care and surgery. And being a clinical associate actually allows you to do that, allows you that flexibility to find what your niche and passion is in this kind of medical field. At the end of the day, we're here, I should hope, we're here because we love helping people, and how we help people and the manner in which we help people, and our purpose in helping people is then what we need to figure out along the way. But what I did see, there was a question for you, Navesh. Someone asked, which do you prefer, or which is a better working environment, private practice or public?
Honestly, I think for me, I personally liked government more, and it's my go-to because I I prefer that catchment of patients. They're less fussy as well. But I think you'd find someone else who say, I like the aesthetic of a private facility because, of course, practicing in government has so much of limitations. And it sometimes can become so frustrating as a practitioner that it affects your mental health a lot. So some people are able to cope under that and some aren't. So my recommendation is do both. You know, go for both. I mean, I think after COVID had hit, government has, contract workers that do night calls, and a lot of clinical associates just serve in the night shifts at hospitals and then have their day jobs, and vice versa. Some of them work a day job in the hospital and do calls in private. So I think you need to do both to see which one you'd actually like. But for me personally, government all the way. I have a passion of serving our lower socioeconomic community to uplift them at that level, considering the type of care I like to deliver. I see there's two more questions. How would one get into research? There's so many ways to it. I mean, if you have something that you'd like to to research, I guess it's very dependent on, of course, you have to have a certificate for good practice skills and so on. And but then these are all short stuff that you can do. And then, of course, when you want to republish a paper, and I'm sure Daniela, Ms. Hoyeman will tell you, because she has done research as well. That you'll have to have ethics approval, and then you have data collection, and it's a whole job by itself. Another close friend of mine also does just that, just research for the University of Pretoria. And the last question, how do you reassure patients that you qualified despite being so young when you had started and having a shorter degree? And this is my sentiment to you. Be so good that nobody can question you. You have to get to that point. You have to put in those hours, be the best so nobody can question you, not even your peers and your colleagues. All right. So, yeah.
Thank you,
That's
Navesh.
it.
Thank you, Navesh. To Shereshnee.
You need to be confident, I think, when you talk to your patients, and that speaks volumes to them. If you've been speaking to a patient and you doubting yourself, they're obviously not going to trust you. So be confident, know your limitations as well. We don't want overconfident people that are going to do risky stuff. So just reassure them that you are supervised as well. I think it's important for your patient to know that, because especially when you're just starting off, they don't want to, they don't trust you if you don't let them know that they will also be seen by a doctor, because especially working in the private field. So in government, patients are just grateful to be seen. In private, patients know their rights and they know that their medical aid is paying for a doctor. So please always let your patients know that the doctor will come. But how I say it is that I am going to help get things moving. I'm going to give you whatever relief you need right now, whatever investigations you need right now, and then the doctor will see you later. That's how I put it to the patients in private. In government, you try and do the very best you can, but also still let them know that the doctor is around, and yeah, confident.
Thank you so much, Shereshnee, for that insight. Before we finish off with some questions, would anyone like to share any comments or inspiration or anything they would like to share?
So yeah, so I thought I could, I mean, with the current situation at WITS with the protests and previous conversations we had about resilience, I thought perhaps I could just share a little bit about, how to navigate major crisis or adversity or just even uncertainty. And I thought to first share my major moments of crisis or adversity. So it actually started even before my university career. So I missed out my first choice degree, first choice university by 1%. I went on to fail first year and faced exclusion. I had to apply to be readmitted to health sciences. I had financial difficulty in the second year of my studies, which led me to actually apply for a bursary to the Gauteng department. I had unemployment post-grad, but I had to, which resulted in me having to write emails upon emails to the Gauteng MEC, which I finally got a job on the 4th of Jan. Then there was COVID layoffs. I was unemployed for about 5 months because the hospitals were closed. And, there's loss of family members. And so what I wanted to share is that, resilience, everyone talks as if it's like something that you get so easy. So maybe to break it down as to what, how do you navigate or how do you get to that point of resilience? And pretty much it's introspection. I think it's through reflection, turning our attention, whilst you're in the fear and anxiety, but not dwelling in that moment of fear and anxiety, but turning towards more constructive emotions and behaviors. And once you've recovered or survived that setback or that adversity, you usually sometimes actually come up with feelings of anger and boredom. And even then, you kind of want to channel those into feelings of motivation to change. And there lies your strength, your resourcefulness, your courage, your determination, which that translates into resilience. You know, you have this sense of, the feelings you get is that self-belief, that optimism. There's like a serenity that you have. And those feelings then translate into your behavior. And the behavior of someone who's resilient, of when you know you're resilient, is when you can reflect on your experience and you start thinking about the future. You know, you become a stronger person. So perhaps what I'd leave everybody in this group to think about, and it's not just the students, but even us as professionals who are navigating, you know, the economic climate, you know, maybe careers, and we're experiencing maybe adversity in work and family life, is what future do you want to create for yourself? You know, is it work, relationships, and family? What does that future look like? And what do you need to create that future? And if you don't change anything, what does the future then look like that you create for yourself by not changing anything? And ultimately, what is, you know, the legacy, or how do you want to be remembered? Those, I think, are quite reflective ways of possibly beginning that journey of developing resilience in this uncertain times. And I think, you know, the function of our souls is to indicate a desire, you know, not to impose our desires, but just to indicate what that desire is, so that our minds can make the choice of seeking that, and then our bodies can act on that choice.
Thank you so much, Dan. I think that's such great, because I think sometimes as students you look at clinical associates that have graduated, and perhaps you think that, you know, we just made it here and without any adversity, and maybe you think that we don't understand the issues that you as students are facing, but as Daniela just pointed out, we've been in those shoes. Many of us have faced, as she said, maybe not your first choice degree that you applied for, or, you know, financial exclusion, academic exclusion, you know, lack of positions, lack of posts, being retrenched or let go of work, as Navesh pointed out, mental issues where your mental capacity does not allow you to continue in a job, as Shereshnee pointed out, issues with the people that you're working with. So that's why these webinars are so important, so that you can hear that we, as much as we say, oh no, we get it, or I understand, or I know this is really tough, we actually do understand, because we have been in some place or similar place or something like that. So just that you know that these webinars are created so that we can have these communities of practice where clinical associate students know that they're not alone in what they're facing, and that we've been there too as qualified clinical associates, and are still there and are still working through a lot of the misconceptions about us, a lot of the, you know, blockages, a lot of the hurdles that we all need to work through. Okay, so as I'm about to close off, I'm just going to quickly just run through one or two questions that I saw in the chat that were important, that maybe were not answered. The one about bursaries from the healthcare department. I know someone did answer that. The precedence was shifted, but have to look at what will be allocated for the upcoming financial year. Does anyone have any comments about the bursary situation with regards to bursaries for clinical associates?
Sorry, for KZN Health, you'll have to approach them if you're from KZN. It's best to contact the provincial office. They're much more keen than the district office. So contact the provincial office and find out if they can. Sometimes they do, sometimes they don't, but it's always worth the shot with them.
And then I see questions surrounding postgraduate qualifications for gynecology. Currently, there are postgraduate certificates, diplomas, and master's programs from various health science institutions for like a specialty such as, or discipline such as gynecology and obstetrics. The best thing is, if that's what you're interested in, Make sure that when you do your elective rotations, if you have an elective rotation, you get stuck into a rotation where your discipline or your passion, where you can explore it and really make sure that you are going towards something that you want to get into. When you are going into your elective rotation, my next advice, if you do have a discipline you're interested in, such as obstetrics or gynecology, that you do try partner up with someone that works primarily in obstetrics and gynecology, so that they can give you insight into what you want, and then start doing research to get your postgraduate qualifications for your desired discipline or speciality. Remember, we are not specialists, we are generalists, we are specialists of everything, and that's a great thing, so that you can always see what you like and explore different avenues. Furthermore, if you do have questions, you can always contact us on our different social media channels, or personally contact us on our social media channels, or personally go speak to someone in your division or your department that is a clinical associate. Like to study further, to work with traditional healers, a route that anyone you know has tried or followed. Just to answer on that quick question about traditional healers, at this in particular, we part of our medical humanities module, so to say, in inverted commas, or program, has got a health system element, and within the health system element, they will be talking about traditional medicine practices and how that then incorporates in healthcare. Yes, there is avenue for it. I don't know anyone that's really done it as a clinical associate particularly, but there is avenues for that. So when you do have that session, please engage with that lecturer to find out how you can get more involved in the traditional medicine avenue. Any final words from our guest speakers? Shereshnee, I'll start with you.
I just wanted to say thank you so much for having me, and thank you for being such a great host. This was amazing, and I love what we do in here. And I hope the clinical associates appreciate it just as much. And yeah, I'm sure in medicine we will all cross paths somewhere, somehow.
Thank you. Navesh, any parting words from you?
All the best for the year ahead. I think my best and warmest wishes to you all, and that you find some happiness in this program. And the lecturers in the team are all amazing across the board. I had seen Tesha has also joined from Walter Sisulu. So you have amazing lecturers across the board, and take solace in the fact that you have chosen right.
Okay, from my side, just another thank you so much for joining us. I really appreciate it. But I really do appreciate all your insights and all your inputs today. This is such an amazing platform to really engage with clinical associates and find out really what is a clinical associate. What am I doing? What did I get myself into? What is this world that I've just deep dived into with no kind of swimming paddles or pool noodle? But rest assured, you have so many clinical associates out there that are fighting the good fight, that are pushing, that love their jobs. We love our jobs. I'd like to say the majority of us really love our job. I, for one, love being a clinical associate. And like the speakers have spoken about, it's about your passion and your purpose. You find your passion, you determine your purpose. You are here for a reason, and while you're here for a reason in the season, it's up to you to use it to its full potential. Don't let this reason go to waste. Don't let this season go to waste. Don't let this purpose go to waste, because someone else would kill to be in the position that you are. So appreciate the position that you're in right now, and if you want to branch out, then go for it. There's no stop, there is no pause, there is just opportunity there waiting for you, no matter what it is you choose to be, where you choose to go at the end of the day. So again, thank you so much for joining us today. Thank you to my people, the Vits people, yay. Thank you to my old people, the UP people, yay. Thank you to the WUSU people. And thank you to every other guest that have joined us today in the session. Our next one is next month. We will send out communication. Have a good night further. If you're getting load shed in the next hour, good luck. Bye.